the state of New York is only going to get $3.8 billion, which will not go very far to cover the need that he says of $15 billion.
Question, yes.
Do you think this bill will keep the economy afloat?
Hopefully a long time. We'll see. If we have to go back, we have to go back. We're going to take care of the American worker. We're going to take care of these companies that fuel this country and make the country great. It's not their fault. It's not their fault. But we think
I would say we've anticipated 3 months. Hopefully we won't need this for 3 months. Hopefully this war will be won quicker. But we expect that this is a significant amount of money, if needed, to cover the economy.
And don't forget, a lot of this is going to be to keep companies that are very strong, AAA-rated companies previously, to keep them going. And it's going to be in the form of loans, so the money's going to come back. A lot of this money's coming back.
Separately, let me ask you about something you said yesterday. You said we should never be reliant on a foreign country for the means of our own survival.
Yeah.
What did you mean by that?
I've been saying that for a long time. Well, we're reliant on many countries where we give up our supply chains, we give up our factories, we give up our production facilities, and we can buy it someplace else for a little bit lower price. But it's really costing us more when that happens because we lose jobs, we lose everything, and we lose our independence, and we can't let that happen. So we'll be making some changes. We have been making those changes.
Is there an executive order to basically ban the export of medical equipment?
I don't know that we'll need that, but I think it's happening by itself. I think a lot of things are happening. Well, some people, we make the best medical equipment in the world, and you have some people like the European Union, they don't take it because they have specifications that don't allow our equipment in because it's designed in a different way. Even though it's a better way, it's designed. They're all playing games against us, okay? They've been playing games against us for years, and no president has ever done anything about it. But the European Union, you look at medical equipment, we make the best medical equipment in the world, but we can't sell it because, or not appropriately. And yet we take their medical equipment in our country. We're changing things, Steve. All this is changing. But they have specifications so that our equipment, designed specifically so that our equipment can't come into their countries. It's a very terrible thing that's happened to our country. And let me tell you, some of the people that took the biggest advantage of us are allies. You know, we talk about allies. They took advantage of us in many ways, but financially as well as even militarily. When you look at, if you look at NATO, the abuse that was given to our country on NATO, where they wouldn't pay. And we were paying for everybody. We're paying. Now, because of me, they're paying a lot. Now they paid $135 billion more. And then ultimately, Secretary General Stoltenberg, who I think you would say is maybe my biggest fan, we got him to pay an additional $400 billion, other countries. And but you know that, and then there's the trade. They make it almost impossible for us to have a fair deal. They know this. They know I'm just waiting. We have all the advantages, by the way. It's going to be easy when I decide to do it. But this isn't the right time to do it. But we've been treated very, very unfairly by the European Union.
Please. Mr. President, 4 Republican senators have indicated that the extra $600 for unemployment insurance may encourage workers to leave their jobs, even though you can only collect unemployment.
I'm going to just jump in there. The president said a lot of very confusing things regarding exporting medical equipment to other countries. The EU's medical device market is the world's second largest, and the United States is its top supplier, according to the U.S. International Trade Commission. So it's really unclear what the president could be referring to when he says the EU is preventing American medical equipment from being imported.
Money out quickly in a fair way, so we used $600 across the board. And I don't think it'll create incentives. Most Americans, what they want to keep their jobs. And I said for 50% of these businesses, they will have the businesses keep those jobs. So this was, our number one issue was how do we make sure that American workers who needed to keep getting paid. This is no fault of their own that businesses have been shut down. The president and vice president wanted to make sure those hardworking Americans got money, and this was the most efficient way of doing it.
Senators that you spoke with, are they in agreement now?
I'm not going to comment on the specifics of where they are, but I would say, our expectation is this bill passes tonight and gets to the House tomorrow, and they pass it. We need to get this money into the American economy and American workers. That's the importance of this.
The one good thing when you think about that, people are going to get actually more money, but we don't want to give a disincentive. But they have been talking about that. It's a good question, actually. Yes, ma'am, please.
Yes, thank you. The family of, on another subject, the family of retired FBI agent Ron.
And I just want to jump in. The president was again harping on this idea of unpaid NATO bills. This is something that has been repeatedly debunked. This has been said to be false. NATO members did make a commitment 4 years ago to spend at least 2% of their GDP on defense by 2024. And but the idea that there are somehow dues, that it's some sort of a club, this mostly seems to be a made-up view by President Trump.
He's been sick for a long time, and he had some rough problems prior to his detainment or capture, and we feel terribly for the family. But
Do you accept that he is dead?
no, I don't accept that he's dead. I don't accept it. I mean, I'm telling you, it's not looking great, but I won't accept that he's dead. They haven't told us that he's dead, but a lot of people are thinking that that is the case. Feel badly about it.
Mr. President, you tweeted earlier linking the closing of the country to your election success in November. Is this Easter timeline based on your political interests?
What do you mean by my election success? No.
You tweeted, you said that the media wants the country to remain closed to hurt your odds
No,
of
I
being
think the
reelected.
media, the media would like to see me do poorly in the election. I think
Lawmakers and economists on both sides of the aisle have said that reopening the country by Easter is not a good idea. What is that plan based on?
just so you understand. Are you ready? I think there are certain people that would like it not to open so quickly. I think there are certain people that would like it to do financially poorly because they think that would be very good as far as defeating me at the polls. And I don't know if that's so, but I do think it's so that there are people in your profession that would like that to happen. I think it's very clear. I think it's very clear that there are people in your profession that write fake news. You do. She does. There are people in your profession that write fake news. They would love to see me for whatever reason because we've done one hell of a job. Nobody's done the job that we've done. And it's lucky that you have this group here right now for this problem, or you wouldn't even have a country left. Okay, go ahead.
The president is again attacking journalists, accusing people in the White House press briefing room of writing fake news. News that the president dislikes is not fake simply because he dislikes it. The people in this room are some of the most respected journalists in America.
Is within 3 weeks, we will have direct payments out where we have depository information, and we're looking to get a lot more information, and we have procedures to do that. So 3 weeks for that, and I would say the end of next week, we want all the banks to be able to originate loans same day.
Secretary Mnuchin is saying that the direct payments will be coming by direct deposit within 3 weeks, but the New York Times has reported for those who do not have direct deposit with the IRS and will be awaiting physical checks, those could take months.
COVID-19 is a zoonotic that was transferred to humans in trade of exotic animals.
Yeah, I don't know that that subject's going to come up. There is a lot of talk that that's how this all happened, came out of China, and they say that's how it happened in China. So it's something maybe will be talked about, but it's not the top of my list.
Yes,
I think we're going to have a very good conference tomorrow.
Well, and also, Dr. Ashish Shah, who is the head of Harvard's Global Health Institute, says that the key to getting this economy open as soon as possible is to test everyone who needs testing so we can quarantine all infected individuals and allow everyone else to go back to work immediately. Would you subscribe to that strategy?
No, but we have tested more than anybody. I saw him.
And if not, how many deaths are acceptable?
Yeah. How many? None. Okay. How many deaths are acceptable to me? None. Okay, none, if that's your question. Look, I saw him. I saw his statement. We have tested by far more than anybody. We're testing more than anybody right now. There's nobody even close. And our tests are the best tests. They're the most accurate tests. But if you're saying we're going to test 350 million people, I watched his statement. I disagree with it. We can go to certain states. I could name them now, but I'm not going to do that. But we can go to certain states right now that have virtually no problem or a very small problem.
The states where there is virtually no reported cases of coronavirus are not coincidentally the states with the least amount of testing. One of the reasons that New York has such a high rate is not only the fact that it has more cases, but that it is testing more aggressively than any other state. The president in this briefing has repeatedly suggested that we've done a better job of testing than other nations have. The experts in the field say the reverse. We spoke to Dr. Ashish Jha of Harvard's Global Health Institute just this week. He said that we have had a much worse response than Iran, than Italy, than China and South Korea, and that this is an unmitigated disaster. That is the assessment from the one of the top minds at the Harvard School of Public Health.
Come a long way from an obsolete, broken system that I inherited. We have now tested with the best test far more than anybody else. When I say anybody else, I'm talking about other countries. No country is even close. They came out with a statistic.
When the president says that we have tested more than any other country and no country is close, he is being blatantly misleading. We have tested far fewer people per capita than most nations. South Korea, which had its first case of coronavirus the same day as the U.S., has tested 6 times more people per capita than the U.S. The president was also talking about what number of deaths would be acceptable. He said that no deaths would be acceptable. It is worth noting that 900 have died in the U.S. as of today.
The G20 countries to do for more resources, for a coordinated stimulus package, ban on tariffs, waive on sanctions to try to prevent what they call an apocalyptic pandemic. Would you consider those measures?
With respect to what?
On tariffs and also related also to waive tariffs and also
Look, we have strong
sanctions.
borders. Yeah.
And would you consider to join this global effort?
So before I came here, we weren't into borders. We had a country, people could come in. We had a whole different deal. Now we're up to almost 164 miles. Think of that, 164 miles of wall, big, beautiful wall. And in those areas, it's very, very tough to come in. We've been very tough on the borders. I mean, where...
The president is making a false statement about the amount of new wall that has built. I'm going to get the number for you that is correct. He's also making a false statement when he says that more people were coming in. Actually, the number of people coming in has increased somewhat under his administration, in part from panic that his policies have caused. And as it relates to the coronavirus pandemic, it's also important to note this is not something coming in across the southern border. Mexico has only about 400 cases of coronavirus versus the 62,000 here in the U.S.
I knew it was 35 million, and we actually took off 10. But I'm a fan of that, although I haven't spent time there because I'm far too busy. I'd love to go there evenings, but I'm too busy.
All right. As of last month, by the way, we can confirm from Customs and Border Patrol that all but 1 mile of this supposed 100 miles that the president is touting is merely replacement of existing fencing. There is only 1 new mile of so-called border wall.
I believe that we've had a very good back and forth, and I say that with respect to Chuck Schumer. I spoke to him a number of times, but you know, they had requests also. So that was a request. There were 35, as you know, and it came down to 25. We got it down to 25. We agreed. I said, that's a lousy soundbite. That's not a good soundbite, but that's the way life works. With that being said, the Kennedy Center, they do a beautiful job, an incredible job. David Rubenstein does a fantastic job. He's very much involved, and he puts up a lot of money, and he does things that a lot of people wouldn't be able to do or do. But they've been essentially closed. They have tremendous deficits that are built up. I mean, this thing has been devastating to it. So I didn't have a big problem with it, but this was a request from the Democrats because of the fact that they have a facility that's essentially closed up.
Yes,
Another question, sir.
In other words, you couldn't go there if you wanted to. If I wanted to go there tonight to look at Romeo and Juliet, I'd love to see Romeo and Juliet tonight, right? You know what would happen? They say, sorry, 250 people or 50 people, whatever it might be down to. Go ahead.
And then earlier today, Senator Marco Rubio.
FYI, there was not a planned performance of Romeo and Juliet at the Kennedy Center tonight anyway. That is not a thing that was going to happen that has been preempted by the crisis.
There were several red flags in his past with respect to his relationship with China. Do you agree? Do you think the World Health Organization showed favoritism? And then once all the dust settles, do you think that the United States should re-explore its relationship with the World Health Organization?
Well, I think there is a lot of, certainly a lot of talk that has been very unfair. I think that a lot of people feel that it's been very unfair. It's been very much sided with China, and a lot of people are not happy about it. At the same time, Dr. Fauci and myself and other people, there are people on there that we like and we know. A lot of, I think your friends are on there, a lot of good people, a lot of good professionals. I don't know, it'd be interesting to hear if you'd like to talk about the World WHO. But the fact is that I have heard for years that that is very much biased toward China. So I don't know. Ralphie, you want me to get you into this political mess?
No, I don't want you to do that, but I will. Tedros is really an outstanding person. I've known him from the time that he was the Minister of Health of Ethiopia. I mean, obviously, over the years, anyone who says that the WHO has not had problems has not been watching the WHO. But I think under his leadership, they've done very well. He has been all over this. I was on the phone with him a few hours ago leading a WHO call.
Transparency, sir?
No, I'm not talking about China. You asked me about Tedros.
World Health Organization praising China for its transparency and leadership on their response to the pandemic?
You know, I can't comment on that because, I mean, I don't have any viewpoint into it. I mean, I don't even know what your question is.
Can I follow up on that phone call, please?
Welcome to the game. You know, let me just tell you, I've heard that for years. I spoke to him yesterday. Seems fine to me. I don't know. But we're the ones that gave the great response, and we're the ones that kept China out of here. And if we didn't do it, you'd have thousands and thousands of people would have died, that are now living and happy. If I didn't do that early, call on China, and nobody wanted that to happen. Everybody thought it was just unnecessary to do it. And if we didn't do that, thousands and thousands of people would have died, more than.
An important thing to note, the president touts his closing of travel from China. What that did was buy time. And the problem is that basically nothing was done during that time to prevent the spread of the disease. And that, again, when we compare the response of South Korea to the U.S., which was on an identical timeline, we can see how the time that was bought by closing travel from China was squandered.
I'll be speaking with Tony. I'll be speaking with Deborah. I'll be speaking with some of the people that they like and respect, and they're going to bring along with them. We'll be speaking to Vice President Mike Pence and Steve, and we'll be speaking to everybody. I'm not going to do anything rash or hastily. I don't do that. But the country wants to get back to work.
I do have to fact check that the president frequently does things that are rash and hasty.
Down for 2 years. We can't do that. It's not our country. So we're going to be talking, and it could be we'll do sections of our country. There's big sections of our country that are very, little affected by what's taken place. Then there are other sections that are very heavily affected. So there's a big difference. But no.
The president is drawing a false comparison between opening the country for business within a couple weeks and keeping it closed for, quote, 2 years. No one is suggesting that the country needs to be shut down for 2 years. The FDA suggests that a vaccine may be available within 18 months. No one is talking about a 2-year period, except for the president.
They can walk around hugging and kissing each other in the office when they come back, even though they may feel like it. They're going to wash their hands more than they've ever done. They're going to do all the things you're supposed to do. But Steve, you know what? It's time. People want to get back to work. I get it from both sides, in all fairness. And maybe it's a combination of both. Tony said before, combination of both is sometimes very good. But
it's been called to my attention that Treasury Secretary Mnuchin just coughed into his hand right behind the president.
Happens, but it'll be an interesting period of time. I'd like to get our country back. I have tremendous numbers of people wanting to go back. You have store owners where the store is sitting there. They don't know what's happening. They got to get back. You have businesses that are going to be closed. The longer we stay out, the longer we do it. We want to go quickly. The longer we stay out, the harder it is to bring this incredible. We were having the most successful years that we've ever had in the history of our country. You saw what happened yesterday with the stocks, and today they're up. I'm telling you, if Steve gets the deal done, the incredible incentive deal is going to take care of people. It's going to take care of our workers. It's going to take care of companies that employ all these workers, small and big. By the way, I would say we spend more time on the small companies, Steve, than we did on the big companies. You know, people ask about that. We spent more time thinking about the small businesses than the...
Now, the president is again repeating the idea that the economy until recently was the greatest in history. The economy has been relatively strong until recently, but not the highest in history, and there were more jobs created in Obama's last 3 years than in Trump's first 3 years.
A question for you on the GPA.
Well, thank you all. A report on today's action by the White House Coronavirus Task Force. The President and our entire team continue to be inspired by the way people all across this country are putting into practice 15 days to slow the spread. We are 10 days into the 15 days. And let me say again to every American, if you're in here,
the Vice President seems to be signaling that this social distancing should end within the next 5 days. None of the analyses that have been publicly discussed modeling the spread of the coronavirus in the U.S. suggest that there will be a resolution of this pandemic anywhere near the next 5 days.
Today, because we truly do believe that, as millions of Americans have done and will continue to do, that we can significantly impact the rate of growth in this epidemic in our country. We can spare Americans from exposure to the coronavirus, and we can save lives. And so on behalf of the President and our entire task force, I want to say thank you to the American people. Thank you for your cooperation. Thank you for embracing the principles in 15 days to slow the spread. We heard about that cooperation today in a series of conference calls. We spoke with equipment manufacturers who are stepping forward as never before to assist us in developing the medical equipment that is essential, whether it be masks or other medical supplies or ventilators. FEMA reported to our task force today that hundreds of companies have stepped forward to be involved in the supply chain, and we are vetting nearly 70 of those countries for specific repurposing of their manufacturing to produce everything from masks to gloves to gowns and, of course, to ventilators. We also had a very productive call with Secretary Betsy DeVos with education leaders from around the country today. And let me say on behalf of the President and a grateful nation, thank you to all of our teachers, many of whom are now home, teaching children from afar, even in many cases while they have their own kids home from school. You are truly heroes, and the Department of Education, as well as your State Department of Education, are grateful to each and every one of you who find yourselves educating out of home. And the Department of Education has a helpful website on coronavirus recommendations, ed.gov/coronavirus. And as we mentioned before, Secretary Betsy DeVos and Secretary Sonny Perdue will be joining us at this podium on Friday to speak about distance learning recommendations that have been made not just for secondary or for college education, but also for K through 12 education. We're opening up avenues, creating new flexibility so that not only college students can continue to be involved in learning from afar, but children K through 12 can do the same. Secretary Perdue will also be here to talk about the food lunch program and free and reduced lunches. Today, the President and I also spoke to over 150 CEOs of the top nonprofit organizations in the country. We thanked them for their ongoing work, supplying the needs not only of people impacted by the coronavirus, but the most vulnerable among us in our communities. Organizations like Red Cross, the Salvation Army, Feeding America are all still working every day. And we promise to urge every American, if you have the means and have the ability, continue to be generous to nonprofit organizations that are helping those most in need in your community. The President marshaled a whole of government approach, and that means working with our governors today. The President and I were in direct contact with governors of New York, California, Washington State, New Jersey, Michigan, and others. And we continue to be inspired and impressed by the leadership that governors are providing in their states, making tough choices, leading their states, and the President and I are truly grateful. The task force made a recommendation, and FEMA has assembled a team to provide technical assistance to the state of New York, and that team was welcomed by Governor Cuomo. Will be arriving on the ground there very soon, along with all the other resources that the President recently announced would be flowing to New York and to Washington State and to California. In my conversation with Governor Gavin Newsom of California, I was pleased to speak to him and hear that our FEMA team is literally at the table with the state of California's team, working to meet their supply needs, working to work on capacity. And I want people to know in the states that are most impacted by the coronavirus that we are with you. We're going to stay with you. We're going to continue to work around the clock to make sure your courageous healthcare workers, your health systems, and your state governments have the resources to support your response. On the subject of testing, Dr. Birx will reflect on what the data is showing in just a moment. Not including local labs and hospitals, we are at 432,000 tests completed. And we're pleased to see that there are literally drive-through and community sites around the country, and the U.S. Public Health Service is assisting states in standing those up each and every day.
These new testing numbers are impressive, but they are very late. And again, comparing the U.S. response to South Korea's response, which had its first case of coronavirus on the same day, South Korea has tested roughly 6 times more people per capita than the U.S., which has played a large role in that country's greater ability to contain the virus.
Single day. On the subject of supplies, before the end of the week, we'll talk a bit more, as the President did moments ago, about the supply chain. I was at FEMA last night and literally saw a room full of people with laptops and cell phones. We are literally leaving no stone unturned, as I told governors today, to find medical supplies, whether it be masks or gowns or gloves or ventilators.
Well, they are leaving some stones unturned, because under the Defense Production Act, the President could be directing all industries to be producing these items now, and not merely calling upon them to do it on a voluntary basis. Governor Cuomo had pointed out that any company that can make apparel, any clothing company, could be creating masks and gowns for hospitals and would probably be happy to do so, but they need to be called upon to do so by the President, and given the resources that would be available to shift over that production as the Defense Production Act allows.
Around the country and encouraging their support. With that, let me last say again, there's nothing more important for the American people to do to slow the spread than to heed your state and local guidance in areas impacted by the coronavirus, and for everyone else to put into practice the 15 days to slow the spread. Dr. Fauci will reflect on the importance of mitigation and the impact that we believe that it is having around the country. But it is, people ask me from time to time, what can I do? And I say from my heart to every American, this is what you can do. Not just to protect your own health and that of your family, but no American wants to inadvertently spread the coronavirus, particularly to those that may be vulnerable to serious health consequences. Remember that the risk of serious illness to the average American remains low. I mean, the vast majority of people that contract the coronavirus will have mild symptoms to flu-like symptoms and will recover. But for seniors with serious underlying health conditions or with people with immunodeficiencies, everyone needs to practice the principles of 15 days to slow the spread. The President announced this week that we are looking forward to the...
This artificial timeline of 15 days, which would be up within 5 days, has been highlighted again. And I do just want to reiterate that public health officials do not see this as a sufficient timeline. The director of Johns Hopkins Center for Health Security said, quote, "To be a week into these restrictions and already be talking about abandoning them is irresponsible and dangerous. Removing restrictions now would allow the virus to spread widely, rapidly, terribly, and could kill potentially millions in the year ahead with huge social and economic impact."
Thanks, Dave.
Thank you, Mr. Vice President, and thank you all for listening to us talk to the American people. We've been watching the testing results. It's very critical to us. It's very critical to be looking at that very carefully. Let me tell you two things that are going on in parallel. Our system to look at flu-like illnesses is still up and running in county after county and state after state. And why is that important? For those of you who've been following the flu epidemic this year, you'll remember we had flu A, then we had another peak of flu B, and those systems that are in every single state and local government is the platform where we can see whether there's any increase in flu-like illnesses. So if you have very few cases in your state and in your counties, maintain your flu surveillance system that you work closely with the CDC on, and look for changes in your slope of new flu-like illnesses. And there are enough test kits, and there's particularly enough of the CDC test kit where we started that runs on your flu surveillance platform to be constantly surveilling what those flu-like illnesses are in our states and counties that have very low number of cases. We have counties still with 0 to 1 cases, but they can participate in the surveillance that we need to have out there now by using their flu-like surveillance system, and we thank all of the states who have that up and running. If you go to cdc.gov and go to flu surveillance, you can see state by state, and you can be looking at those curves with us. It's what we're looking at day by day, in addition to the testing results that are coming in. For the testing results, still, there's 4 counties that constitute the majority of both the current cases and new cases. I think you know those are New York City, Westchester, New York, Suffolk, and Nassau County. Those are the 4 counties, all associated with New York and the New York metro area. There's a few counties in New Jersey, but this is still where 56% of the cases are and 56% of the new cases. It's very important that people look at the number of new cases per day. Remember, we told you it was going to take us a while to work through the testing backlog. I think we're close to working through the testing backlog so that you can interpret the number of cases per day, and you will see in New York City that the number of cases per day has been relatively constant over the last 3 days. Those are the number of new cases per day. This is a real call to every person in New York City and the New York metro area to continue every one of these 15 days to slow the spread, and to do that part of it at the same time that they're following the mayor's and governor's there's peace. Yesterday, we talked about people that may have left the metro area that were residents of the metro area that may have gone to secondary homes or other places to reside. And we've asked all of them to carefully monitor their temperatures and self-isolate from the communities where they went, just to ensure their own health and the health of their communities while people move around the country. Finally, why this is so important. It's very important to me personally because my grandmother, for 88 years, lived with the fact that she was the one at age 11 who brought home flu to her mother, named Leah, for which I am named, when her mother had just delivered. And her mother succumbed to the great 1918 flu. She never forgot that she was the child that was in school that innocently brought that flu home. This is why we keep saying to every American, you have a role to protect each and every person that you interact with. We have a role to protect one another. It's why we are social distancing and you are social distancing. But to every American out there, when you are protecting yourself, you're protecting others. And if you inadvertently, I know, brought this virus home to someone with a pre-existing condition, I can tell you my grandmother lived with that for 88 years. So this is what we're trying. This is the message that's important to everybody. This is not a theoretic. This is a reality. You can see the number of deaths that are occurring. We all have a role in preventing them. So thank you for the work that you do to get our message out to others, to really ensure that every American understands how important their role is as we move through these next 5 days, to not let up for an instant. I hear some reports that someone said, oh, well, the new cases in New York are increasing or the hospitalizations are increasing. The number of new cases over the last 3 days have been consistent, but not rising any more than a consistent day-over-day rise. You will see hospital cases continue to increase because they are a reflection of what happened 1 to 2 weeks ago before the full mitigation efforts were put into place. So each person in every place, no matter what county, what community, what state, can work with us to ensure that we prevent the spread of this virus to others. So thank you.
Thank you, Mr. Vice President. I just want to spend a couple of minutes telling you a little bit about some information that I got on our weekly call that we have at least once a week with the WHO, which is led by Dr. Tedros and Mike Ryan, who's the point man there, to give us some information. And in that regard, I want to apologize for my curt response to you when you asked me about the China deal, because I shouldn't have done that. That's not my style. But what I really wanted to say is that my job is that I'm a scientist, I'm a physician, and I'm a public health person, and I don't like to get involved in that stuff. So anyway, getting back to the WHO. So we learned some really interesting information because obviously the other countries like China and others had been hit prior that we did. One of the things that was striking to me, and I just throw it out because it's something that we will face. We're not facing it now, but we will face. Our Chinese colleagues are very concerned because they went through the entire cycle of the curve to come down. And they have very, very few cases. But what they're starting to see as they're relaxing the constraints on travel, that they're getting imported cases. And they wanted to warn us that when we get successful, make sure you very carefully examine how you're going to release the constraints on inputs. So I know we're going to be successful in putting this under control, but I think we're going to have to remember we don't want to import cases in. That's the first thing for today. The second thing that was important is that it was something that Dr. Birx mentioned, and that is when you look at the inflection of the curves, we now have multiple different countries that have gone through various phases of their individual outbreaks. And you could learn something from them about where you are in your own outbreak. For example, when China went up, what happened is they just didn't turn around. They went from going to, I'll just take an arbitrary number, 500 new cases a day. The next day it was 1,000 cases, then 1,500, and then 2,000. But once the number of new cases each day starts to flatten out, that's when you get to that point where the inflection goes down. So if what things we want to look for, the things that Dr. Birx had mentioned, that doesn't mean you declare victory when it does that, but you know you're at least on the way to where you want to go. And I think that's really very important. The third and final thing that I think gets back to the question that many of you in the audience have asked of us is about, would this possibly become a seasonal cyclic thing? And I've always indicated to you that I think it very well might. And the reason I say that is that what we're starting to see now in the Southern Hemisphere, in Southern Africa, and in the Southern Hemisphere countries is that we're having cases that are appearing as they go into their winter season. And if, in fact, they have a substantial outbreak, it will be inevitable that we need to be prepared that we'll get a cycle around the second time. What does that mean for us and what we're doing? It totally emphasizes the need to do what we're doing in developing a vaccine, testing it quickly, and trying to get it ready so that we'll have a vaccine available for that next cycle. In addition, to do the randomized controlled trials of drugs so that we will have a menu of drugs that we have shown to be effective and shown to be safe. Because I know we'll be successful in putting this down now, but we really need to be prepared for another cycle. And what we're doing, I believe, will prepare us well. Thank you.
Thanks, Doctor. We'll take a few questions, please.
Mr. Vice President, on ventilators, some really important reporting from the Center for Public Integrity today. They suggested that there's only 16,000 in the national stockpile. Can you just give us some clarity? How many ventilators do you have in the national stockpile? Who else is making them, and how long will it take for them to make a critical mass? Because based on the Center for Public Integrity, it appears there aren't enough if people are going to die as a result.
Ventilators has been a singular focus of a good portion of our supply chain stabilization task force at FEMA since the President stood up FEMA's National Response Center. And we're making progress in a variety of ways. First, there is the national stockpile, which you refer, and depending on what's been distributed, we just delivered 4,000 ventilators to New York, including ventilators that we sent to New York City. But there's that number of some 20,000, less than 20,000. I won't dispute your number. Beyond that, there literally are, by most estimates, more than 150,000 ventilators in the broad healthcare system all across the country. We also, working with anesthesiologists, and there was a very important conference call today, we have determined several weeks ago that the devices that anesthesiologists use for outpatient surgery can be converted with the change of a single vent to a very useful ventilator. I actually spoke to Governor Cuomo about that today. He's in the process of surveying all of his surgical centers, as governors around the country are doing. We literally believe there's tens of thousands of ventilators that can be converted now that the FDA has...
Now, the Vice President is celebrating the 4,000 ventilators that FEMA is sending to New York, and this is a good thing. But Governor Cuomo has said that to meet the state's needs, New York will need 30,000 ventilators.
Production, those contracts are being reviewed. We're vetting their capability. But one of the other ideas is, as we look at areas of the country that are most impacted, and now more than half of the cases for coronavirus are in New York State and in the region around there.
Additionally, the Society of Critical Care suggests that the nation could need over 1 million ventilators to address this crisis. And as the questioner mentioned, the existing stock is somewhere around between 160 and 200,000.
Coronavirus, and making sure that we're manufacturing, backfilling, and meeting that need. But what I can tell you is we've got an extraordinary team. Admiral Polovchek is a two-star Navy admiral who's doing an incredible job. We literally are identifying resources around the country and around the world. We're contracting and arranging transportation for those. But maybe Dr. Birx, you can speak to the ventilator,
Thank you.
transition.
Thank you, sir. So I just want to thank Dr. Mary Peterson and the whole team of the American Association of Anesthesiologists, because they immediately, when we asked them, could these be modified, they went to immediate work on it. They're going to have Q&As up but more importantly, every anesthesiologist in every city has been working with their state and local health officials to really work with them how to change this. And I think that's not only the ventilators that they'll be supplying, they have the people that run those ventilators that are not any longer doing elective surgery. So changing that elective surgery piece over a week ago has freed up a lot of additional resources. When I talk to you about how we've done some things that are very horizontal across the country, but we're collecting data now in a county by county granular way. So it's like any epidemic, it's not equal everywhere. There are places that are very spared, and there's places where there's more. We have a very vast country with a lot of capacity and a lot of infrastructure. And so looking very specifically about where the virus has been, where is it going, who's got freed up resources from where it has been, because it didn't hit it hit Washington State earlier than it hit New York, and looking at all of those pieces to really ensure how we can innovatively move equipment around based on the need. And so I know that it has become a place where people are looking at numbers rather than what is needed. Because if you do these projections, when you got to those projections that said, like in Germany and others, that implied that 60% or 50% of the population would get infected, I want to be very clear, the only way that happens is this virus remains continuously moving through populations in this cycle, in the fall cycle, and another cycle. So that's through 3 cycles with nothing being done. And so we're dealing with the cycle A right now, not the one that could come in the fall of 2020, although we're getting prepared for it by the innovations that are being worked on, and not the 2021. We're really dealing with the here and now while we're planning for the future. And I think the numbers that have been put out there are actually very frightening to people. But I can tell you, if you go back and look at Wuhan and Hubei and all of these provinces, when they talk about 60,000 people being infected, even if you said, oh, right, well, there's asymptomatics and all of that, so you get to 600,000 people out of 80 million. That is nowhere close to the numbers that you see people putting out there. I think it has frightened the American people. I think on a model that you just run full out, you can get to those numbers if you have 0 controls and you do nothing. And we know that every American is doing something. And so I think what our job right now is to carefully detail on a hospital by hospital, state by state, county by county, to outline what the infrastructure needs are and ensure that we're meeting them, both from the stockpile and from the generosity and movement of the American people and other hospitals.
Dr. Burks, a lot of folks out there, well-intentioned, are sewing cloth masks and donating them to hospitals. So you or Dr. Fauci, can you weigh in on that? Because obviously these people have great intentions, but there's some mixed feedback on whether that's a good idea.
I'm sorry.
Better than nothing? Lots of surgical masks. People are sewing them. So clothing manufacturers, volunteers dropping them off at hospitals. Is that necessary? Is that helpful? Is it something you'd recommend?
Well, I mean, you would only recommend that under desperate situations if you don't have any masks. But what we're seeing now, as you've heard, is a rather significant inflow of masks that are coming in that are going to be available. I mean, obviously, if you don't have a mask and you need a mask and it's appropriate for you to be wear it, you do what you can. But I don't see that now as a necessity given what's going on right now.
Great. Great.
Mr. Vice President?
We'll take a couple more. Thanks.
Thank you, Mr. Vice President. We keep hearing reports of competition among states that are trying to buy this necessary equipment on the private market. And the governor of Kentucky said yesterday that his state was in line to buy some equipment, but FEMA came in and purchased it from under them. So he says this is creating a real problem for states because on the one hand, they're being told to get the equipment themselves if they can, but on the other hand, the federal government is buying up the supply chain. So is this a problem that you're hearing about, and what is your advice to states like Kentucky that are having this issue?
I actually spoke to the governor of Michigan today, Governor Whitmer, and I, about just that. And we put our FEMA regional representative right on the case. We want to make sure that we're acquiring every bit as much as we can through FEMA, but as we work with the supply chain, we want to have full coordination with the states and the requests they're making and hospitals that they're making, and we're looking into those matters. But make no mistake about it, this FEMA team at the President's direction is leaning into this effort, leaving no stone unturned, literally searching not just the nation but the world for all these critical supplies. And as the President just reported to you, we're in the process of shipping 9.4 million N95 respirators, 20 million surgical masks, 3.1 million face shields, and the list goes on. And we're going to be...
Again, the Vice President is saying that they're leaving no stone unturned, but numerous governors and even conservative Senator Ted Cruz have called upon this administration to use the Defense Production Act to require companies to produce this equipment in large scale. The Department of Health and Human Services estimates that 3.5 billion face masks will be needed for the U.S. to face this crisis.
Is adequately supplied.
Well, I'm going to let Dr. Birx address that as well, but let me say again, I just received a report. We're going to be detailing it before the end of the week, where we've literally identified significant resources, not just around the country but around the world, of the masks that can be used by healthcare workers. But as Dr. Birx said, we are focusing those resources in the areas where healthcare workers are most exposed to the prospect of contracting the coronavirus. The President's made it clear from early on, right after seeing the needs of Americans who are struggling with the coronavirus, making sure they have the support that they need on the same level of priority. We want our healthcare workers to have the personal protective equipment to be able to do their job safely, and we're working on that. I will tell you, I spoke about this today to several governors, not only the governor of Michigan, but the governor of Indiana, and President Trump and I couldn't be more grateful. The way governors around the country are joining us in calling on businesses to go back to their warehouses and identify industrial masks, N95 masks, that because of the change that President Trump insisted on in the law, can now be used by hospital workers. And they're perfectly acceptable to protect a healthcare worker from the possibility of a respiratory disease. But we're calling on, and our governors are joining us in calling on, every business across America during this time of great challenge where many businesses are idled. Go back to your storehouses, identify N95 industrial masks, and as I told our governors today, they can call FEMA, they can call the state healthcare services, or they can just load them up on a flatbed and drive them over to their local hospital. And literally, we hear stories in every state in the union of people doing that. And so it's happening all at the same time, and we'll be detailing the progress we're making on masks. Anything further, Deb?
Thank you, Mr. Vice President. I just wanted to add one piece, and this is really a call to every state out there and every county that has been doing community-based testing. The FDA put out new guidance, we talked about it several days ago, that people can do self-testing in the drive-thru, where you give them the materials to do it in their car and you pick it up in a biohazard bag. This would free up all of that PPE that you see being utilized in those drive-thrus back to the hospitals and back to the clinics that need it the most. We have to move to the new technology. FDA worked tirelessly to get that out there so that it could be sparing of gowns and gloves and full respiratory N95s. This is the moment to move to that self-testing front of nose with the new applicators that can be utilized so that every single bit of the N95s can be put into the hospitals that need it.
Dr. Birx?
Mr. Vice President.
Let me just say we look forward to seeing you all tomorrow. We'll be back here with further progress and news. But if I could just say to every American,
Is he okay? He keeps asking
we'll
if
get through
you're
this.
okay. He keeps asking you if you're okay.
We'll get through this. But we'll get through this together. Every American needs to understand that whether you are in an area that's impacted by the coronavirus or an area where there's very few cases, if you do your part to put into practice 15 days to slow the spread, you will do just.
I do want to share a quote from Governor Cuomo about why just calling on companies is not the same thing as directing them through the Defense Production Act. He said, when we went to war, we didn't say, any company out there want to build a battleship? Who wants to build a battleship? Maybe a couple of you guys could get together and build a battleship. Instead, you direct the production of these things. And the problem is that companies could be making these masks, could be making these PPEs, and they have not been directed to. The president has directed governors to get them on their own. Maryland's Governor Larry Hogan said that he has, Massachusetts Governor Charlie Baker said that he was actually outbid by the federal government while he was trying to order supplies. Anyway, that is today's Coronavirus Task Force press briefing. Thank you for joining us, everyone. Please stay safe. Use this time to keep yourself safe, your family safe. Tell the people you love how much they matter to you. And we will all get through this together, and NowThis will do our best to keep you informed. Thank you. I'm Alan Piper, and on behalf of our team, stay safe and have a good night.
Or to keep the lights on. In this frightening and dangerous and unprecedented moment in modern American history, as we do everything possible to grapple with this crisis and to address it as best we can, it is also appropriate to ask ourselves how we got here and what this says about the financial and economic structure of our country. In other words, I suspect that right now, all across this country, people are asking themselves, how does it happen that in the richest country in the history of the world, when we are spending twice as much per capita on healthcare as the people of any other nation, how is it possible that doctors and nurses today do not have the kind of masks they need to protect themselves? How does it happen? They don't have the gloves. They don't have the gowns. How does it happen that we don't have the necessary ventilators that we need in the midst of this crisis, or the ICU units, or even the emergency beds that are so very important? And I think furthermore, as we think about the moment that we are in, people are understanding that there is something wrong, that we are the only major country on earth not to guarantee health care to all as a human right. And when we think about the moment that we're in, we're thinking about how does it happen that so many people are living in economic desperation and are so frightened about what the next few weeks will bring to them. How does it happen that so many of our people are working for jobs that have not allowed them to put money in the bank? Look, this crisis, this epidemic is going to impact everybody. In Fairfield, Connecticut, one of the richest counties in this country, there is an epidemic. Rich people are hurting. The heir to the British throne, Prince Charles, has been diagnosed with the coronavirus. And that is a very, very wealthy family. But in the midst of all of that, if you got money at least, all you got to worry about is health care. You don't have to worry about how you're going to survive financially. But for many, many millions of our families, that is not the case. And we have got to think and think hard about how we create an economy that works for all. so that we don't have 40% of our population unable to afford a $400 emergency. Now, let me say a few words about the package that will be likely coming up on the floor of the Senate tonight or tomorrow. Number one, I have insisted, as have many progressives, that this is a time in which we have got to spend what it takes. And let me begin by saying that I believe this package, which is called the Coronavirus 3 package, is not going to be the last package. It will do some good. I expect that there will be a Coronavirus 4 package in not too many weeks. This package, though, is about $2 trillion, not to mention the many trillions more that will be spent by the Fed. This package provides the largest expansion of unemployment benefits in American history, an increase of over $250 billion. Under this bill, average Americans who have been furloughed will be able to receive up to 100% of their salary and their health insurance for 4 months. For 4 months. Weekly unemployment benefits will increase by $600. So if you are laid off, your unemployment benefit will increase by $600 above what it otherwise would have been. And right now, the average benefit is about $364 for workers. Now, also, very importantly, this expansion of unemployment will include part-time workers. It will include gig workers, like those who drive Uber cars. It will include tip workers and the self-employed who would otherwise not be covered by unemployment insurance. So in other words, what we're doing now is at a time when fewer than half of the American people would normally be covered by unemployment. What this legislation does, it is expands it to the overall workforce, and on top of that, for many workers, would provide $600 a week more than they otherwise would have gotten. And that is one of the more important provisions in the bill. In addition, this bill provides $250 billion to go out in one-time checks of $1,200 for adults and $500 for kids. Now, let me be very honest. As some of you may know, I wanted much more. I wanted every American family to be able to receive $2,000 every single month that we continue to exist within the crisis. So this does not do that. And this is clearly not enough to me, but that is what it is. As you may recall, Republicans originally wanted to provide smaller checks or no financial assistance to the poor or very low-income Americans. In other words, I guess their mentality was that if you're poor, you deserve less, even though you're struggling more than anybody else. But that is not going to be the case now. The agreement will now provide the same financial assistance to poor and low-income Americans as the middle class. These checks will phase out for individuals making more than $75,000 a year and households making a combined income of more than $150,000. On top of that, there will be some $367 billion going out in loans to small businesses that, importantly, those loans could be forgiven if these small businesses do not lay off workers. And that is very, very important because the goal here is to try to maintain payrolls. As many of you may know, what is going on in the UK, what is going on in Denmark is, I think, the proper approach. What they are saying to employers is we will provide 80-90% of your payroll if you maintain those workers. They may be furloughed, they may be working at home, But we, the government, in the UK, was 80%. And that is the direction I think we should have gone right here. But we didn't. There is another approach. But what, again, we are saying, what this bill says to small businesses is that the loans they receive could be forgiven if these businesses do not lay off workers or expand employment after the crisis is over. Furthermore, in this legislation, there is $150 billion that will be provided to states and cities who are today very desperate in terms of their need for a cash infusion to respond to the crisis. These are cities, these are states that are not bringing in the tax revenue that they need, and this infusion of cash will be able to make sure that they maintain payroll. You know, when we're talking about this crisis and we're talking about reaching out to people, you do that through the government, through the federal government, through the state government, through the local government. And if local and state workers are laid off, it will be virtually impossible to get the benefits out that are in this bill. So furthermore, what we are now talking about is over $100 billion that will be provided to reimburse hospitals and medical providers for lost revenue related to the coronavirus. And that is a major, major concern. Right now, there are hospitals all over this country who fear that they will be overwhelmed with patients suffering from the coronavirus. They are now needing to expend money for ventilators, for ICU units, and the revenue that they normally are getting in for surgeries and other procedures is not coming in. So this is a desperate need, and there will be that money available to those hospitals all across this country. In addition, something that has been important to me for many, many years, there will be an additional $1.3 billion to be provided in emergency funding for community health centers who are an integral part of the primary health care system in this country. I think you're going to see a lot of folks coming into the community health centers, and they're going to need the additional help. Furthermore, there will be $1 billion provided for the Defense Production Act to begin to ramp up production of personal protective equipment, ventilators, and other medical supplies, and billions more for federal, state, and local health agencies to purchase this equipment. As you have heard me say before, it is beyond belief that the President of the United States has not fully utilized the Defense Production Act. And what that act says is that the private sector, companies in the private sector, being well paid for their efforts, must convert their production away from consumer goods to the medical needs and other needs that the American people need right now. Now, the truth is, we don't need at this particular moment in history more T-shirt production, more underwear production, more sock production. What we do need is the production of masks for our doctors and our nurses and for others. We need more gowns, for protective gowns for our medical personnel. We need more gloves. And that is what the Defense Production Act is, and the president must fully utilize that act. This legislation will also make certain that Americans can receive a free test for the coronavirus. But unfortunately, and this is again sad, it is pathetic, but it is the world that we live in, the Republicans would not agree to make the treatment free. So right now, in the midst of this crisis, what this bill says, okay, the good news is if you can find a test, and that is another crisis, there aren't enough tests available around the country, you can get it free of charge, government will pay for it. But if, God forbid, you are diagnosed with the coronavirus, well, you're on your own. Well, what happens if I don't have any money? Well, that takes us back to the whole dysfunctionality of our current healthcare system, but that is what is in this bill. In addition, over $7 billion will be provided for affordable housing and homelessness assistance programs. This funding will help low-income and working-class Americans to avoid evictions and help the homeless. Now, I worry very much that in the midst of this crisis, and I think we'll maybe do another virtual town meeting on the issue, I worry about what happens to the most vulnerable people in this country, people who are currently in penitentiaries and jails, people who are homeless, people who are living on the brink. This legislation, this proposal goes some way forward, but I don't think anywhere near enough. Furthermore, in the proposal, there will be $3.5 billion provided for the Child Care Development Block Grant to provide child care assistance to healthcare sector employees, emergency responders, sanitation workers, and other workers deemed essential during the response to the coronavirus. And I think the point here that everybody should appreciate is, yes, doctors and nurses and medical personnel are on the front line. They are working, they are putting their lives on the line to do everything they can to keep the American people healthy and prevent deaths. But they're not the only people who are putting themselves in danger. People who are working in grocery stores right now, who are interacting with many customers, people who are working in drugstores, police officers, firefighters, first responders, sanitation workers. All of these people are putting their lives on the line to protect us, and many of them have kids. And what this provision does is say, okay, if you or your wife cannot be at home, there will be money available for child care for your children. In addition, nearly $16 billion in this bill will be provided to help our nation's veterans, including funding to treat veterans who have tested positive for the coronavirus, enable them to purchase test kits and procure personal protective equipment for medical providers at the VA. And in addition, some $590 million in dedicated funding to treat vulnerable veterans, including homeless veterans and those in VA-run nursing homes. So this is an effort to make sure that we understand that there are a lot of veterans out there who are in trouble, they're vulnerable, and they have got to be protected. In addition, over $30 billion will be provided in grants to help provide emergency support to local school systems and higher education systems to continue educational services for their students and to support school districts and institutions during this crisis. I mean, one of the many aspects of this crisis that worries me a whole lot is that all across this country, millions and millions of kids are not in school right now. I know some school districts are doing better than others, trying to provide online classes, trying to get teachers to interact with their kids. But there's no question but that public schools, private schools for that matter, higher education institutions are in a lot of trouble as a result of the crisis. In addition, there will be $25 billion that will be provided to our public transit systems to help protect the public health and safety of Americans while ensuring access to jobs, medical treatment, food, and other essential services. What you're seeing all across the country is obviously as people are staying home, as they're not going to their jobs, fewer and fewer people are using public transportation. And this is causing a major financial crisis for many public transportation systems all across this country who are already strapped to begin with and now are losing substantial sums of revenue. So this is an effort to keep those public transportation systems going so that people who have got to get to work will be able to have a means to do that. In addition, there will be $900 million provided in emergency energy assistance to help lower-income families and senior citizens pay their heat and air conditioning bills. Further, there will be $500 billion in business loans to be distributed at the discretion of the Treasury Department. Let me stop here, because this is, to my mind, the most problematic provision in the bill. And it concerns me, as I think it concerns many Americans, very, very much. You will all recall back in 2008 during the Wall Street bailout, there was a blank check written for Wall Street and for financial institutions, not only in this country, but all over the world. Central banks received trillions of dollars in zero-interest loans. Now, this bill, in my view, is a lot better than that 2008 Wall Street bailout bill, which I voted against. But I am very, very, very concerned about a $500 billion that will go out to the corporate world without, let me underline, without the accountability and transparency that is needed. We do not need, at this moment in history, to provide a massive amount of corporate welfare to large, profitable corporations. I think, as many of you are aware, you have industries like the airlines industries, among others, that have provided for stock buybacks, billions and billions of dollars for stock buybacks. They spent all their cash rewarding themselves and their stockholders. And lo and behold, today, they need a major bailout. So the concern here is, A, do we trust the Trump administration to effectively decide which company will get the loans or the grants? The answer is no, I do not. Do we think that these loans and grants during a political season will be used to benefit the president's election prospects? Absolutely, I do. So this is the most problematic aspect of this whole bill. $500 billion going out to corporations as determined by the administration. On the positive side, I would say, is that this financial assistance, which will no doubt go to the tourism industry, will go to hotels, airlines industry, other concerns, there has been a provision put into it, which obviously makes sense, is that there will be no financial assistance going to any business owned by Donald Trump, Mike Pence, members of Congress, or any of the billionaires in Trump's cabinet. It will also prohibit companies from using this financial assistance to buy back their stock or to enrich their executives. But I must tell you, there is a waiver in that which concerns me very much. Obviously, if you're going to give money to companies, you don't want to see that the CEO saw a significant increase in his or her compensation. You don't want more buybacks. The language prohibits that, but there is a waiver which I fear could be used. Further, as part of the oversight process, the final bill will establish a panel to provide oversight to this money and an independent inspector general to protect taxpayers against waste, fraud, and abuse. But in my judgment, that is probably not enough to prevent the kind of corporate welfare that will be going out to entities all across this country who really don't need it, who are taking advantage of the crisis. So that is a broad overview of the bill as it stands right now. My understanding is there will be a vote either late tonight or early tomorrow. So once again, this bill is not the bill that I would have written. On the other hand, it is a much stronger pro-middle class, pro-working class bill than was the 2008 Wall Street bailout. There will, in fact, be billions and billions of dollars going out to put desperately needed cash in the hands of workers, in the hands of lower income people, in the hands of families. There will be substantial sums of money going to hospitals who desperately need it. There will be substantial sums of money going to cities and towns and counties who are also in financial desperation. So that is kind of an overview of where we are right now. And let me just reiterate something that I believe absolutely is, and that is that in this moment of crisis, perhaps a worse crisis than this country has ever faced in the last 100 years, while we address all of the needs of our people as best we can, given who the President of the United States is, given who the leadership of the Senate is, that while we do our best to address these crises, it is extremely important that we try to understand how we got to where we are today and the need to bring about fundamental reform of American society. And I think, as many of you know, it is my belief that instead of having a government based on greed and corruption, we need to move forward in terms of justice, in terms of economic justice, social justice, racial justice, environmental justice. We need to guarantee human rights to all of our people and end this unfettered capitalism and this survival of the fittest. And that means we must make healthcare a human right for all. It must mean that we guarantee a job for all of our people at decent wages. It must be that we understand that housing, affordable, high-quality housing, is a human right, that education is a human right, that when you turn on the water faucet in your house, you have the right to make sure that that water is clean and the air that you breathe is clean, and that when you reach old age, that you will retire with security and dignity. So the goal right now is to do our best, taking on Trump and the Republican leadership in the Senate, to fight for working families. But in addition to that, our goal is to create an America that works for all of us and not just the few and the powerful. Good evening, and thank you very much.
Conditioning, that we make it sound. I would be investing $100 billion in my infrastructure plan on making sure that the schools in America are able to be, you're able to breathe the air, drink the water, and a whole range of other things that don't happen now. And there's so much more, but here, let me give you one other thing, two more things. One is that I think we should become the net exporter of technologies that allow nations around the world to be able to get to zero emissions. And we can do that. That's why I'm talking about spending $400 billion right off the bat in new research and development and technology, so we become the net exporter of the capability for other nations to be able to move in the direction towards zero emissions. And we mentioned foreign policy before. Right now, the Amazon is burning. They're burning the Amazon so they can clear cut, so they can have it for agriculture. We should be organizing the hemisphere and the world, which I've done before, in helping get the climate change, the Paris Accord in place, saying, here's the deal, Brazil. We, the world, will contribute $20 billion to you to avoid cutting down the Amazon and burning it. Because guess what? The Amazon is a giant carbon sink, they call it. More carbon is absorbed from the air into those plants and into the Amazon than all the carbon emitted in the United States on a daily basis, every single day. Imagine what happens if we don't stop that. It's called global leadership. It's called global leadership. I, along with Dick Lugar, a guy who passed away, a Republican senator from Indiana, years ago, introduced and passed the first bill that said, we will, if you don't burn down your forest or cut them down, we will forgive you debt. We will forgive debt. And so we should be focusing not only locally, but worldwide. America, if we went to zero emissions in America, that takes care of 15% of the problem. 85% of the problem is around the rest of the world. But we can't get the rest of the world to act unless we do our part in making sure we take care of our 15%. So look, I'm hoping that this is just the first in our ongoing conversations we have, and maybe we can go into more detail the next one on global warming. And you know, it's all about issues, about our future, about your future. And you know, this pandemic lays low how important it is for us to have experienced leadership in the White House and listen to the experts, to follow the science, somebody who knows how to manage a crisis. That's why I'm running for office. Donald Trump has done an incredible damage to our national character, our international reputation, and someone who can restore trust and credibility in leadership at home and respected leadership around the world from day one is critically needed. But if I'm elected president, I'm also going to be a leader who will help spur progress forward, empowering the next generation of leaders to seize the possibilities that are out there, not to drag us backwards. I said in Michigan that I see myself as a bridge to the future. I really mean it. That's why I've made the commitment, as I said, for an administration that's going to look like the country, including choosing a woman running mate. That's why I've wanted to make sure we spend today talking to you and hear your ideas. And I hope we can continue to do this because, look, here's an example. Think of this. Your generation and all generations are now facing an existential threat from this disease. Look what's happening. People are pulling together. This is the United States of America. Look what's happening. We have a friend of mine who used to work with me. He's down in South Carolina. He sent me an image of he has a daughter named Zoe who's in kindergarten. Guess what? He got a call from her teacher and every kid in that school got a call saying, I'm going to be riding by your house at such and such a time. Be in the driveway, wave to me, say hi. Say hi. People are out cutting elderly people's lawns. They're shoveling snow. They're doing things. This is America. We have never failed a country when average Americans have been just given an even chance. We have never failed, ever. And I think we should just take a look at the American spirit now. I am so damn proud. It sounds corny, but I'm so proud to be an American. I'm so proud the way you see. Remember I said we have to deal with this idea of restoring the soul of America? You're seeing the soul of America now with ordinary people doing extraordinary things. I hope we can do this again soon. Thank you so very much.
Thank you, Mr. Vice President, and no better way to end. And I would say to everybody, go to joebiden.com, read about all the incredible things that he wants to do for this country. Follow Joe Biden on Twitter, and I'm sure we'll do this again. Thank you, everybody.
That we'll do together. Thank you.
Thank you so much. Absolutely. Great job. Good job, guys.
for what they might have to show that they're in need of? I know there's a range of what they could qualify
for. There is,
for.
as I said, between $10,000 and $20,000. All of the parameters are going to be on there. I mentioned some of the categories, again, really targeted to small businesses. And so encouraging everybody to go to that website to see if you qualify. And again, some of these short-term helps, these loans and microloans, and in some cases grants, can really make all the difference, particularly in the next month.
Thank you.
Again, and I want to thank our council president and the city council for recognizing how important that is with today's unanimous vote.
Just a quick question on the evictions. I mean, the moratorium ends on the 31st. Is this going to be extended? Can it be extended? You know that typically that's...
We will have the opportunity to extend, and that is something that we will work together as a city to do that should it become necessary.
And there was talk also about working with banks in terms of forgiving loans and things of that nature.
I'm glad you asked me that question because mortgage relief is going to be incredibly important, particularly for landlords. And so I can't say enough about our financial institutions here in San Diego. We're really rising up to not only help with some of that mortgage relief and programs that they have, existing programs, but other programs that they're looking to tailor to this specific crisis. We also heard today, I think we're going to have some support out of the state of California in terms of mortgage relief. So this is an all hands on deck approach because you have to be able to help those in need and longer term individuals as well. With that, thank you. Appreciate today's questions, today's updates, and we will be back tomorrow at 4:30. Thank you. Thank you, Jim. Thank you, Jordan. Thank you. Thank you, guys.
Is my volume? Oh. Hey, Amanda, can you make sure Carlos has me up? Because they're talking to me and I guess. Can you hear me now?